Today, I'm going to talk to you about cardiac catheterization. So what is cardiac catheterization? Cardiac catheterization is a procedure used to diagnose and treat cardiovascular conditions. In doing so, a long, thin tube, which is also called a catheter, is placed in the patient's artery or vein. Common locations are the groin, the arm, and the neck. The arm, the cardiologist will utilize the radial artery. In the groin, the cardiologist will utilize the femoral artery. This procedure is a sterile procedure, which is typically done in a cardiac catheter lab, which is very similar to an operating room. Once this catheter is inserted in the artery or the vein, it is advanced through the blood vessels to the heart. The catheter is guided via X-ray imaging, and dye is typically injected through the catheter so that the X-ray videos can be utilized to assess for the coronary arteries, the valves, and chambers of the heart. Typically, this procedure will be done on an outpatient basis unless the patient has other underlying medical conditions. Some of these medical conditions may include a myocardial infarction, heart failure, or other complications that may have arose during the procedure. Patients are typically awake during this procedure but heavily sedated, while a local anesthetic is used to numb the area where the catheter is being inserted. So why is cardiac catheterization needed? Cardiac catheterization is a medical procedure that can be utilized to diagnose and treat certain cardiac conditions. Your doctor may recommend cardiac catheterization to find out the causes of symptomology associated with chest pain or irregular heartbeat. In addition, cardiac catheterization can be utilized to assess whether the patient has ischemic heart disease. Ischemic heart disease can be caused by atherosclerosis, which causes narrowing or blockages of the coronary arteries. Cardiac catheterization can also be used to assess the cardiac function and volume of blood pumping throughout the heart. In the event that there is a narrowing or a blockage within the coronary arteries, a coronary angioplasty can be utilized to improve blood flow. Cardiac catheterization can also be utilized to detect congenital heart defects, assist in repairing or replacing heart valves, as well as closing off a portion of the heart to prevent blood clots. In utilizing cardiac catheterization, the physician is able to take a closer look at the heart to identify the problems, as well as perform additional tests if needed for the patient's individualized care. What are the types of cardiac catheterization? Right heart catheterization evaluates pressures and oxygen saturations in the chambers of the right side of the heart and the function of the tricuspid and pulmonary valves. Complications associated with right heart catheterization include arrhythmias, infection, perforation of the chamber wall. Left heart catheterization evaluates patency of the coronary arteries and the function of the left ventricle and mitral and aortic valves. This is done so by inserting the catheter into the radial or femoral artery and advancing it to the aorta and the left ventricle and then the coronary arteries. Complications associated with left heart catheterization include arrhythmias, acute myocardial infarction, perforation of the heart and the great vessels, and systemic embolization. Angiography includes the injection of contrast agents into the vascular system to visualize the heart and blood vessels while assessing patency. Arterial hemostasis can be obtained by manual pressure, mechanical compression devices, percutaneously deployed vascular closure devices, or external patches to initiate immediate hemostasis and shorter bed rest. Complications associated with arterial hemostasis include bleeding around the closure device, infections, and arterial obstructions. What are some preoperative nursing interventions? It is important for the nurse to obtain a thorough history. In obtaining this history, the nurse should identify drug allergies, lab work, current medical conditions, previous medical conditions, as well as prior cardiac catheterizations. Patients with an allergy to contrast material must be pre-medicated with corticosteroids as well as antihistamines. Patients with chronic kidney disease need to be prehydrated to reduce compromising their renal function any further. The nurse should complete a very detailed head-to-toe assessment. Additionally, the nurse should also assess routine lab work. In assessing routine lab work, the nurse should find out if the patient discontinued any anticoagulant use 3 days prior to the procedure. Baseline coagulation studies should be done, and these include the PTT and INR. The INR should be less than 1.8 to minimize the patient's risk of bleeding. A CBC should also be obtained as a baseline to compare with post-procedure results. This allows the nurse to assess for any blood loss. Additionally, metabolic function should be assessed via electrolytes and glucose, as well as renal function through BUN and creatinine. Obtaining a chest x-ray and baseline ECG are also recommended. Patients should be NPO for 6 hours prior to the procedure, as well as educated on what to expect after the procedure is complete. What are some post-operative nursing interventions for cardiac catheterization? First and foremost, it is important for the nurse to understand the risk factors associated with this procedure. Some of these risk factors include bleeding around the point of insertion, blood clots, infection, allergic reactions to the contrast dye, arrhythmias, myocardial infarction, stroke, as well as perforation of blood vessels. In understanding the risk factors associated with this procedure, the nurse can then identify the nursing interventions that must occur. Assessing the catheter site for bleeding as well as hematoma formation is important. If the nurse identifies a hematoma development, they must notify the healthcare provider immediately and apply direct pressure with gloved hands for up to 15 minutes. Depending on the severity of the hematoma, hemodynamic instability may occur, resulting in the need for IV fluids and blood. Transradial access sites should be utilized if the patient has risk factors associated with bleeding. Monitoring for arrhythmias, cardiac monitors can be utilized. Additionally, the nurse can assess apical and peripheral pulses for any type of pulse deficits. When the catheter is removed, bradycardia may occur. Treating this bradycardia can be done so by elevating the extremity above the heart, infusing IV fluids, and administering IV atropine to increase the patient's heart rate. The patient must maintain bed rest for anywhere from 2 to 8 hours, depending on their procedure. If the leg site was utilized, the leg must be kept straight and the head of the bed can be elevated up to 30 degrees. The nurse must assess peripheral pulses, capillary refill, and neurovascular status of the patient. This allows the nurse to know that perfusion is occurring. Additionally, the nurse should educate the patient on reporting signs of chest pain, bleeding, or any discomfort from the catheter site. Expanding my knowledge and my understanding of cardiac catheterization will impact my nursing practice moving forward. The reason it will impact my nursing practice moving forward is because I am now confident in knowing and understanding the risk factors associated with cardiac catheterization. Additionally, I understand that cardiac catheterization is the gold standard for assessing for coronary artery disease, as well as quantifying the extent of coronary artery obstruction, pulmonary hypertension, and valvular heart disease. This allows me to know, understand, and implement the nursing interventions that are necessary before and after the procedure.